All right, Dr. Henderson here for another video. This one we're going to talk about what's called a radical or simple nephrectomy. If we talk about a radical anything, it means we're usually taking it out for cancer. If it's a simple anything, we're taking out the organ for pain or discomfort or poorly functioning or something like that, or not taking out the entire organ, but just a part of it. We're going to talk about a radical or a simple nephrectomy, removing your kidney for cancer or some other reason. We used to do these open. It was a big, huge incision. There was lots of recovery time, higher risk of bleeding. It transitioned over into laparoscopic surgery, and now it's transitioned even farther into a robotic-assisted laparoscopic procedure. The reason everybody has transitioned to this is less blood loss, less pain after the procedure, shorter hospital stays. Those three things are the main things they've found with all robotic surgeries, so it's a great way to do it. We actually just do 3 little incisions, 1 by your belly button, 2 on the side of the area where the kidney we're going to take it out. We go into your stomach, we take you to the operating room, put you to sleep, make those 3 incisions, and we go into the belly. We just dissect around the kidney. We clip or staple across the artery and the vein, and we'll clip the ureter, and then we take out the whole kidney. Everybody says, you're gonna take out the whole kidney through one of those little sites? No, we will, but we have to open up one of them. So we usually open up the one by your belly button because in the middle is where your muscle kind of meets, so we can go through that section so there's less pain and kind of spread that area open and close it back up. It's very interesting, but your skin can stretch pretty wide. So usually the porthole site is just the size of a dime or smaller, and the site that we have to open up to remove your kidney looks about 2 or 3 dimes afterwards, so it still looks really good cosmetically after the procedure's over. Everybody worries about, am I going to go on dialysis? Are there going to be issues with my renal function? As long as the other kidney looks like it's functioning, or we can actually do kind of function studies or send you to the medical kidney doctor, the nephrologist, or do some imaging that shows us functioning. But as long as that other kidney is functioning, you really only need the one. That's why we can donate kidneys if somebody needed a kidney transplant or something like that. The procedures are usually anywhere from an hour to 2 hours. It just kind of depends if we're doing this for cancer or if we're doing this for pain or a poorly functioning kidney. Afterwards, you'll be in the hospital. Most of my patients go home same day because there's not a ton of pain with this. And I usually do a pain pump in the middle too. It just dumps lidocaine into your incision, the bigger incision where we take out the kidney, and you take it out in 3 days at home. That helps with post-op recovery as well, where most patients go home the same day, some go home the next morning. Afterwards, what to expect? Same thing with other laparoscopic surgeries. No heavy lifting for 4 weeks. Any surgery where you have incisions, no getting into a bathtub, a hot tub, or a pool, but showering is okay for about 2 weeks. Just let those incisions heal. And then if we're doing this for cancer, we will follow up with the National Cancer Guidelines and imaging and whatever they recommend. If it's for other reasons with pain or a poorly functioning kidney, there's usually not much follow-up to it. But it's a great procedure, very straightforward, and not a lot of pain, not a lot of cutting now like we used to, so patients do very well.